Have you been feeling unusually tired, getting short of breath more easily, or noticing that your body simply doesn't have the energy it used to? Don't automatically blame it on getting older. Iron deficiency can affect the blood's ability to carry oxygen, and some of the signs can be surprisingly easy to overlook. Today we're going through 12 signs you may be low in iron, and stay with me, because near the end I'll show you how to build an iron-supportive plate using everyday foods, including plant-based and Caribbean-inspired choices. This video is for educational purposes only. These signs cannot diagnose an iron deficiency. Similar symptoms can occur with other nutritional deficiencies, medical conditions, sleep problems, stress, and many other causes. If your symptoms are persistent, severe, or concerning, speak with a qualified healthcare professional about whether evaluation or blood testing is appropriate. Let's begin with one of the most familiar signs: persistent fatigue. Not simply, "I had a busy day." I'm talking about the kind of tiredness where ordinary activities seem to require more effort than they used to. Iron is essential for hemoglobin, the protein in red blood cells that carries oxygen. When iron deficiency progresses to anemia, reduced oxygen carrying capacity can contribute to fatigue and weakness. But here's the important part. Fatigue has an enormous list of possible causes: poor sleep, stress, other nutrient deficiencies, thyroid problems, infections, medications, and numerous health conditions can also leave you exhausted. So don't diagnose yourself from tiredness alone. Instead, look for a pattern. Number 2 is unusual weakness. Perhaps carrying groceries feels harder. Maybe climbing stairs takes more effort. Or you've noticed that your usual physical activities suddenly feel much more demanding. Iron plays an important role in oxygen transport and muscle metabolism. Iron deficiency anemia can be associated with weakness and reduced exercise tolerance. But again, weakness isn't specific to iron. So the question isn't, "Do I have weakness?" The better question is, has my normal level of energy and physical capacity changed, and why? Number 3. Getting unusually short of breath during activities that normally wouldn't leave you winded. Maybe you're walking uphill, climbing stairs, or carrying something around the house. When anemia is significant, there may be less hemoglobin available to carry oxygen, and shortness of breath can occur. But shortness of breath deserves respect. It can have many causes, including heart and lung conditions. So please don't assume that breathlessness means you simply need more iron. If it is new, persistent, severe, or occurring at rest, that's a reason to seek medical attention. Number 4 is dizziness or feeling lightheaded. You might notice it when standing up, walking, or during periods of unusual fatigue. Dizziness can occur with anemia, but it can also have many other explanations, including dehydration, blood pressure changes, medications, blood sugar problems, and other conditions. So think of dizziness as a signal to investigate, not a diagnosis. If you're fainting, repeatedly becoming lightheaded, or experiencing severe symptoms, don't try to solve the problem with an herbal tea. Find out what's happening. Number 5 is a visual change, looking noticeably paler than usual. Sometimes the change is subtle. You might notice it in your complexion, the inside of your lower eyelids, your lips, or the palms of your hands. Paleness can occur with anemia because of changes in red blood cells and circulation. But skin tone naturally varies, and lighting can change how someone looks. So this isn't something you should diagnose from a mirror. It's more meaningful when a noticeable change appears alongside other symptoms. Number 6. Headaches. Headaches can occur with anemia But this is another symptom with countless possible causes: stress, dehydration, poor sleep, hormonal changes, migraine, vision problems, and many others. That is why I want you to pay attention to patterns rather than isolated symptoms. If headaches are new, frequent, severe, or changing, that's something to discuss with a healthcare professional rather than automatically attributing them to iron. Here's one that many women notice. Your hands or feet seem unusually cold. Cold hands and feet can occur with anemia, and NHLBI lists cold hands and feet among symptoms associated with iron deficiency anemia. But there are many other possibilities, including normal individual differences, environmental temperature, circulation issues, and other medical conditions. So if you're constantly reaching for a blanket while everyone else is comfortable, don't immediately assume it's iron. Look at the whole picture. Number 8 moves from what you feel to something you can actually see. Changes in your nails. Brittle nails can occur for many reasons, but in some cases of iron deficiency, the nails can become fragile, and a condition called koilonychia can cause the nails to become unusually concave or spoon-shaped. This is not something to diagnose yourself from a photograph. If your nails have changed significantly, especially along with fatigue or other symptoms, it's worth discussing with a healthcare professional. Number 9 is one people don't always connect with: nutrition. Changes in the mouth or tongue. Iron deficiency can be associated with oral changes, including inflammation of the tongue. You may notice soreness, unusual smoothness, or discomfort. But mouth changes can also come from other nutritional deficiencies, infections, irritation, dental problems, medications, and other conditions. So once again, we're looking for the pattern, not one isolated clue. Now we're getting into a much more unusual signal. Number 10. Craving and repeatedly chewing ice, or craving things that aren't actually food. The medical term for persistent craving or eating of non-food substances is pica. Ice craving, sometimes called pagophagia, can occur in people with iron deficiency. But here's why I want you to take this seriously. If you have persistent cravings for ice or non-food substances, don't simply start taking iron on your own. Tell your healthcare professional. This can be a valuable clue that deserves investigation. Number 11. Restless legs. Perhaps you're sitting in the evening and feel an uncomfortable urge to move your legs, or the sensation becomes especially noticeable when you're trying to rest. Iron deficiency has been associated with restless leg syndrome, although restless legs has multiple possible contributing factors, and not everyone with restless legs is iron deficient. If this is happening repeatedly, especially at night and interfering with sleep, it's worth bringing up with a healthcare professional, because your sleep deserves attention too. And number 12 brings us to something you should never casually dismiss: a noticeably racing or pounding heartbeat. When anemia becomes significant, the heart may work harder to deliver enough oxygen to the body. That can contribute to a faster heartbeat or palpitations. But palpitations have many causes. Caffeine, stress, medications, thyroid problems, heart rhythm problems, and other conditions can all play a role. So if you're experiencing new or persistent palpitations, especially with chest pain, fainting, severe shortness of breath, or other concerning symptoms, seek medical care rather than assuming you need iron. Now, I promised you one more important piece of information. This one isn't really a symptom of low iron. It's a possible reason your iron stores may become depleted, and that is heavy menstrual bleeding. Every menstrual period involves some blood loss, and blood contains iron. When menstrual bleeding is unusually heavy, the amount of iron lost can eventually exceed what you're replacing through your diet. NHLBI identifies heavy menstrual bleeding as an important risk factor for iron-deficiency anemia. So, if you're experiencing unusually heavy periods, particularly if you're soaking through pads or tampons very quickly, passing large clots, or feeling increasingly fatigued, please don't simply reach for an iron supplement. Talk with a healthcare professional about the bleeding and the possibility of iron deficiency. The cause of the blood loss matters. So now you may be thinking, how do I know whether I'm actually low in iron? This is where we have to separate education from diagnosis. You cannot determine your iron status from symptoms alone. A healthcare professional may consider your symptoms, medical history, diet, menstrual history, physical examination, and blood tests. A complete blood count can help evaluate anemia, while tests such as ferritin and other iron-related measurements may help assess iron status. And this is important. You can have symptoms for many reasons that have nothing to do with iron. So don't let a YouTube video, including mine, replace proper evaluation. If testing does show iron deficiency, the next question is why? There isn't one answer. Sometimes the issue is simply that someone isn't getting enough iron through their regular diet. But iron deficiency can also occur because the body isn't absorbing enough, because the body's needs have increased, or because iron is being lost through bleeding. Heavy menstrual bleeding is one possibility. Bleeding somewhere in the digestive tract is another. Certain digestive conditions can interfere with absorption, and some medications or health conditions can affect iron status or contribute to blood loss. That's why treating the number without understanding the cause isn't always enough. The goal isn't simply get more iron. The goal is find out why iron is low and address the reason. Now let's move into the part I know many of you love. What can you actually put on your plate? Iron comes in two dietary forms: heme iron, found in animal foods, and non-heme iron, found in plant foods and fortified foods. If you're eating plant-forward or fully plant-based, you can absolutely build meals around non-heme sources, but absorption is generally lower than that of heme iron, so food choices and overall dietary patterns matter. Some useful plant-based sources include beans, lentils, peas, tofu, nuts, seeds, dark leafy greens, and iron-fortified grains and cereals. And here is where vitamin C becomes your friend. Vitamin C can improve absorption of non-heme iron, so rather than thinking only about individual foods, think about food combinations. For example, a bowl of lentils with tomatoes and peppers, beans with a fresh citrus-based salad, leafy greens alongside a vitamin C-rich fruit, or tofu with colourful vegetables. And this is where we can bring some Caribbean inspiration into the kitchen. Think about meals built around beans and peas, leafy greens, vegetables, whole grains, and colourful fruits. Callaloo-style leafy greens can become part of a nutrient-dense meal. Moringa leaves are also traditionally used as a food in many regions, including Caribbean communities. But I want to make one distinction very clear. A traditional herb or leafy plant is not automatically an iron treatment. Use herbs as food or part of a culinary tradition where appropriate, not as a substitute for finding out why your iron may be low. Your plate is part of your wellness strategy. It is not a laboratory test. Let's make this practical. In the morning, Build your breakfast around an iron-containing food. For example, an iron-fortified whole-grain cereal with fruit, or a savory breakfast containing beans or another plant protein. Add a vitamin C-rich fruit or vegetable. At lunch, think legume plus leafy green plus colourful vegetable. A lentil or bean bowl with leafy greens, tomatoes and peppers is simple, filling, and gives you several nutrient-dense foods in one meal. And in the evening, don't make your routine complicated. Prepare a balanced meal containing a source of iron, vegetables, and a source of vitamin C. If you enjoy traditional herbal teas, keep them as a separate part of your relaxing routine, rather than assuming the tea itself is treating iron deficiency. And remember, some beverages, including tea, can reduce iron absorption when consumed with an iron-containing meal, so timing can matter. Now, my dear, this part matters. Please don't hear this video and think, I'm tired, so I need an iron supplement. Iron is an essential nutrient, but more is not automatically better. Excessive iron intake can cause harm, and iron supplements should be used thoughtfully rather than simply because someone has symptoms. And if you take medication, have a chronic condition, are pregnant or breastfeeding, or have been diagnosed with an iron-related condition, speak with your healthcare professional before beginning an iron supplement or concentrated herbal product. Food is a wonderful place to begin, but persistent symptoms deserve proper evaluation. So let's bring everything together. The signs we discussed include persistent fatigue, weakness, unusual breathlessness, dizziness, paleness, headaches, cold hands or feet, nail changes, mouth or tongue changes, unusual cravings such as ice, restless legs, and a racing or pounding heartbeat. But remember, one symptom doesn't tell the whole story. The important thing is the pattern. And if you're experiencing several of these signs, or if they're persistent, don't guess. Find out what's happening. Then, if your diet needs more iron, build that nourishment into your everyday meals with foods that work for your body, your culture, your budget, and your lifestyle. If you're a woman over 35 who wants to understand what your body may be communicating through nutrition, traditional herbs, plant-based foods, and everyday habits, subscribe to this channel. We're going to explore these body signals one at a time, and we're going to bring the conversation back to the kitchen, where nourishment becomes something practical you can actually use. And in the next episode, we're moving from iron to another mineral women often hear about, magnesium. I'll show you the body signals that may be associated with not getting enough, and which foods can help you build a magnesium-rich plate. Until then, nourish yourself with intention,